afya yetu, jukumu letu.
Ndio, ndio.
Afya yetu, jukumu letu.
Ndio, ndio.
Afya yetu, jukumu letu.
Your Excellency, the Ambassador of Denmark, we have just agreed that we don't mention names. The Chair of Novo Nordisk, the Member of Parliament of Gatundu, my Principal Secretary, that one I know her name very well, Madam Mary Mudhoni Morioki. Our partners present, I see my spiritual father, Karibu Sana. I also see my other spiritual father, Tamwenda, Karibu Sana. The board members of Kenya Medical Training College who are present here, the CEO of Kmtc together with your staff, and the students of Gatundu Kenya Medical Training College. Good afternoon. Good afternoon. Watu wa Gatundu, Muriega. Asante. I am excited to join you this afternoon in unveiling this partnership today, Partnership for Education and Health Professionals. When I was making the decision whether to come or not, I was thinking I have appeared at KMTC very many times. And Kenyans might start wondering whether as a minister I have other jobs or just to go to KMTC. But I think it's because I have some roots in KMTC. So I'm really pleased to be here. And I want to thank the Novo Nordisk Foundation for this partnership. And truly from the bottom of my heart, I know Novo Nordisk has been a partner to Kenya for many years, as said by the Excellency Ambassador. It actually reminds me many years ago, I think close to 13 or 14, thereabout, when I was working as the head of supply chain for Mission for Essential Drugs. And one of the things that I did then is to negotiate for the access program to insulin with Novo Nordisk. So I know as a country, Novo Nordisk is our partner for many years. And with this new addition, on behalf of the government of Kenya, on behalf of the Ministry of Health, and on behalf of the people of Kenya, on behalf of the people of Gatundu, I want to say thank you to Novo Nordisk. I want to appreciate the Kenya Medical Training College for the role that you are going to play in implementation of this project. I am told that this project will be a hub and spoke model, which is a model that as a ministry we have taken in ensuring that we deliver services to many Kenyans as much as possible and where they are, going to the people in mashinani. So I want to appreciate Kenya Medical Training College and to direct you that you must do it with the precision that we have always discussed. Ensure that you get it right, because I see this as an opportunity, not just for the Kenya Medical Training College, but for the country, to ensure that we have fit for purpose human resources for health. Because we have been graduating many students. You spoke of last year over 22,000. The previous year over 15,000. But a good number of them are outside here, still jobless. Yet, our facilities are full of patients with non-communicable diseases. So for me, this is a masterstroke in ensuring that we have fit for purpose human resources for health. Those who have talked before me, and for those I managed to listen to, I'm sure you have talked about the increasing cases of non-communicable diseases, cardiovascular diseases inclusive. Yet, Mheshimiwa, these diseases are preventable to a very large scale. That if we only did the right thing, they are not supposed to be taking a chunk of our health budget as they do now. And that's why as a government and as a ministry, we have my army, and I'm happy I can see them on this side, community health promoters. These are the people that we have planned should get into the societies, into the communities, into each and every household, so that we start screening early. We promote healthcare. They give education to the households so that we are able to tackle this rising burden of NCDs from the bottom. And it aligns with His Excellency the President's Kenya Kwanza manifesto of bottom-up economic transformation agenda. That in everything we do, we begin from the best. And the rationale is that is where people are. Had I not come to Gatundu, I wouldn't know the people who are here, isn't it? And you have given us a classic case of the issues that could be within our communities. So these are the people who are going to assist the ministry in ensuring that we do not wait for people to get sick, that we prevent diseases. We ensure that we have a healthy community. I also want to highlight that I am informed that this partnership will help us to have a network of knowledge sharing, that we shall be able to work with the best that there is. I want to believe that Novo Nordisk is a market leader when it comes to management of cardiovascular diseases and other non-communicable diseases. That then as we partner, our students at Kenya Medical Training College are going to be able to learn from the best and therefore cascade it down to ensure that we give the best to the people, to the citizens of this country. My PS has said, in our focus on management of human resource for health, we have agreed that we will manage starting from production. And our greatest factory for production of health workers is Kenya Medical Training College. And so I'm happy that through this partnership, then we are going to ensure that our products that we channel out from our factory of human resources for health are fit for purpose and able to do the job that we intend them to do. So, ladies and gentlemen, I am happy, but having said that, actually, I had invited a friend of mine to be the chief guest to this function. I think he got delayed, the Honorable Cabinet Secretary Moses Kuria. He's the one that I had wanted him to be the chief guest. I'm told he's on the road. So before he arrives, I think I'll take a few minutes just to highlight what it is that the ministry is doing in managing healthcare. I'm not sure if I'll get another opportunity to come to Gatundu and tell the people of Gatundu what the government is doing. I know right now, many Kenyans are anxious. Now that I said NHIF is a leaking basket or bucket, they are wondering what else. We have Social Health Authority. Social Health Authority is to take care of everyone. In Mheshimiwa, your parent was lucky because you are a member of parliament. And not just because you're a member of parliament, but you're one who comes home frequent. So for those people who are not as lucky as your father could be, it is a social health authority that is going to take care of them. Our intention is to ensure that each and every Kenyan is covered. That as and when you need medical attention, you get it where you need it. So what have we done so far? We have ensured that products are available through Kmtc. When this government came into office, supplies at Kmtc were at 40%. Right now, we are at about 68%. That is an upward trend. And all this is to ensure that when you go to the pharmacy next to you, when you go to the facility next to you, you should be able to get products. I have been moving around the country, and I'm always tempted to ask, nataka watu wa Gatundu wanijibu. Je, nyenye mkienda hospitalini huwa mnaandikiwa dawa muambiwe mkanunue kule nje ama huwa mnapata ziko hapo? Mnaambiwa mnunue nje? Hazikuangi? So we must resolve that, si ndio? And also to understand from the people of Gatundu. Kuna wale huwa wanalipa NHIF. Lakini naambiwa wakienda hospitalini mara mingi wanaambiwa hii kadi yako hauwezi kulazwa nayo. Ni outpatient peke yake. Ni ukweli ama ni uongo? Ni ukweli. Na kuna wengine wanaambiwa hii kadi yako ya NHIF imeisha. Sasa ongezea hiyo pia ni ukweli. Ndio kwa maana tumeleta Social Health Authority. Na katika hii Social Health Authority, wale ambao mapato yao ni ya chini kabisa wamekuwa wakilipa shilingi 500, sasa wataanza kulipa 300. I thought you were going to clap louder than that. You know, in this era, people are used to things going up. So when you say something that is going down, I think it takes time for people to appreciate that truly umesema inateremuka. NHIF wale watu wa mapato ya chini watakuwa wanalipa shilingi 300 kutoka shilingi 500. Katika hizi sheria mpya, watu wale wana mshahara mkubwa sana kama Mheshimiwa Gakombe. Ukiona hiyo koti yake si ya pesa kidogo, si ndio? Ukiona hii koti ya Madam PS si ya pesa kidogo. Ukiona huyu Principal Kelly hii suti amevaa ni pesa mingi sana. So katika hizi sheria mpya, wale ambao wako kama mimi tunaweza afford kununua kajacket kazuri kidogo kama aka kangu, tulipie wale ambao hawana uwezo. Si hilo ni jambo nzuri? So sisi wale tuko na mapato tutakuwa tunatoa 2.75% ya pesa zetu ili tulipie wale ambao hawana uwezo wa kulipa. And the other day I was with your colleague, the MP from a constituency in Baringo. And he was telling me he has worked out 2.75% of $1 million, and at the rate of 300, it means that he's going to be able to take care of 91 people in his constituency, him as an individual. And so for him, he has agreed that he is going to look for people to adopt people in his constituency to pay for them the 300 shillings. And that is a game changer for this country. So for those of us who have an income, please. Because I know if I asked you to get out your phones and we check your WhatsApp groups, you're in more than one group fundraising for a patient somewhere. And if not a patient, fundraising for a funeral. So our 2.75% is going to take care of those ones. And I want Kenyans to hold me accountable that now we bring the WhatsApp groups for fundraising to an end through the payment of the 2.75%. The regulations are out there under public participation. So please come and give us your views. But the third benefit of the Social Health Authority, the new acts, is the Emergency, Chronic, and Critical Illness Fund. That once a Kenyan, you have been diagnosed to have a chronic illness, diabetes, hypertension, then you do not have to care about the cost of treatment. The government is putting up a fund. Immediately you exhaust your Social Health Authority, the fund kicks in to take care of you. Tuko na wagonjwa wengi sana ambaye akiamka asubuhi anaanza kufikiria pesa yake ya insulin itatoka wapi. Na ndio watu tunataka kushughulikia na hii Emergency, Chronic and Critical Illness Fund. Watu wa Gatundu, hiyo Emergency, Chronic and Critical Illness Fund ni nzuri ama ni mbaya? Si ni nzuri? Ile wewe unajua tu hauhitaji kutafuta pesa kwa mfuko, kama uko na diabetes serikali inakushughulikia. Sio ni jambo nzuri? Mami unasemaje, ni nzuri kabisa? Kwa hivyo niendelee. I don't know why people on this side are not talking. Now let me address the people on this side. That in this Social Health Authority, everyone is covered, including the students of Kenya Medical Training College. You are covered. How you are covered is once the head of your household, your parent, your guardian, pays for their insurance, they have paid for everybody within their household, whether you are a student or not a student. So long as you have not reached the age where we consider you to be an adult to be on your own, that is 25 years and above. But anyone below that, then you are covered under your household. So when you get sick while at college, you should not be wondering how you'll get treated. You are covered by the Social Health Insurance Fund. And that gives the parents a level of comfort. They know that their students at school are taken care of. And for the people here, you're getting a relief that you're going to close the WhatsApp groups. You're not going to wake up and find yourself in 2, 3, 4, 5 groups that are fundraising for an illness. So that is what we want to achieve with our new laws on Social Health Authority, to ensure that all Kenyans have access to healthcare. We have fixed the commodities, we have fixed the financing under the insurance, we are fixing equipment. Today we have just advertised for a tender to support counties so that the facility closest to you has equipment, has supplies, and very soon we are going to start to fix the human resource for those facilities. Now that I'm in Gatundu, this facility here, under the previous government, it was a national referral facility. Unfortunately, when this government came into place, or I'm not sure whether it's unfortunate or fortunate, the governor said he would like to run this facility. But I was just looking at that building and thinking it might be too big for the county government to manage. I'm looking at it and looking at the proximity of other facilities around, then truly there needs to be a referral facility. So we are going to work with the leaders the political class from this area, together with the governor, the members of parliament, and I'm sure we'll do some form of public participation so that the people of Gatundu agree that the national government runs it. In the meantime, it was being run by Kenyatta University Teaching and Referral Hospital. And for the record, that is our best referral hospital in the country. So you can imagine if it is under the tutelage of one of the best referral facility, then it is going to be one of the best facilities in this country. And the beneficiaries of that great facility are going to be the people of Gatundu, who will be the first people to get here whenever they have an issue. We will work together to ensure that that transition is smooth, that we are able to provide services to the people of Gatundu. CHPs, mulipata kits? Muko nazo? Good. Muko nazo. Simu? Muko na simu mpya? Good. So, kwa hivyo hii serikali inafanya kazi. Muko na kit, muko na simu. Sasa imebaki pe? Ule mtu mwenye ako na hiyo kibeti ni huyo Modhoni. Sasa Modhoni, unastahili waambia wa CHPs hiyo kibeti unafungua saa ngapi wapate pesa yao, ama namna gani? Good. Amesema ministry yeye already amepata 1 billion. Yes, CHP wote Kenya mzima. Simumpigie makofi, ako na pesa. Sasa Madam PS uko naye na hawa nao watapata siku gani ndio usiku wetu umekaa nayo? Anytime from now. Lakini simejua mtu wa kuuliza. Nitamkanyagia nihakikishe mumepata pesa yenu. Si ndio? Asanteni sana. May God bless you. May God bless the people of Gatundu. May God bless all the partners who are working with us at the Ministry of Health to ensure that we deliver health care for this country. And may God truly bless Novo Nordisk for this partnership and the many more that will be coming in the future.
Tukiwa na afya vijijini tuna afya. Ndio, ndio. Tukiwa na afya vijijini